Good evening, everyone. We will start in a minute. Good evening, everyone, and a very warm welcome to WGH India Dialogue Series on engagement of frontline health workers in COVID response in India. Let me take a moment to also reflect on the journey of women in global health, WGH. Recognizing that more than 75% of the healthcare workforce are women, yet they continue to be a minority in the decision-making and leadership spaces within healthcare. This served as the motivation to change and bring gender parity in these spaces. And Women in Global Health was founded in 2015 as a global movement. Today, WGH operates in different geographic zones around the world. It's through its country chapters, of which 9 are existing and 19 more are in the pipeline. The India chapter of Women in Global Health was formed last year to take this agenda forward in India. As COVID-19 spread its tentacles across the world, the India chapter, recognizing the crucial role of frontline health workforce, sought to provide a virtual platform, not just to share best practices, but also to learn from each other, as well as amplifying the contributions and highlighting the concerns and challenges. The WGH Dialogues series started with listening to the concerns and challenges of ASHAs, organized in June, which garnered an overwhelming response, leading us to take the series forward. And we brought in the ANMs in July to understand their perspectives. In August, we brought forth another important cadre of health workers, the members of women collectives and self-help groups. This dialogue series, we seek to bring virtually to the national platform the leaders at the front line of yet another group. The first part of this series, conducted a few days back, brought the elected women representatives of the Panchayati Raj institutions. This series is offered in collaboration with Women for Politics Center for Catalyzing Change. And we seek to amplify and highlight the contributions of these leaders. During the discussion, several challenges were highlighted. A few key ones that they mentioned was the challenge to mobilize and community members, migrants, to follow the rules laid down during lockdown and social distancing. They also talked about the different challenges that they faced with shutdown of the regular activities. They also spoke about how they engaged different stakeholders for the response to COVID. They also put forward several recommendations which spanned from further capacity building of frontline health workforce, as well as the need to gear up the engagement of different stakeholders in pandemic response work, and the need to focus on women economic empowerment, or the need to take further extra measures for vulnerable population groups, or even to offer different livelihood options. Another important recommendation they had was to ensure easy, hassle-free information flow from different stakeholders. So today, as we move into this particular series, this particular session, I'd like to take a few minutes to introduce our collaborating partner, Center for Catalyzing Change, C3, formerly known as Center for Development and Population Activities. Started working in India in 1987. In the last 30 years, C3 has emerged as a key change-making organization focused on improving the condition of girls and women in the country. C3 is committed to equal participation of women in governance and leadership roles as a step towards building a stronger nation. The other collaborating partner is Women for Politics, an initiative with an aim to improve women's political participation and representation across Southeast Asia through awareness and advocacy. Among other activities, WFP led the Beyond Victim series that highlighted stories of various South Asian women political leaders with an aim to amplify the work of women politicians fighting COVID-19. And today, we have an excellent panel of policymakers representing different stakeholders who will throw light on future directions. With this short note, I welcome you all once again for joining us, and thanks to WFP, C3, and WGHI for putting this series together. Let me also take the last minute to introduce our moderator for the evening. Madhu Joshi is Senior Advisor, Gender Equity and Governance at C3. She has been working on gender and development for over 28 years, with progressive experience initially as an activist with women's organizations, and later in advisory and management capacity at South Asia and national level with international organizations like Oxfam. Her thematic expertise extends to a range of gender and development issues, including gender-based violence, women's political empowerment, reproductive health, gender, and social exclusion. Madhu has led the evolution and scaling up of C3's Pahal model of Panchayat women's leadership since 2012. She also leads C3 Gender-Focused Evidence to Policy Hub that aims to build timely, granular data and evidence to inform gendered policy making. On this note, I welcome all of you to listen and reflect much. And let me take this opportunity to hand over to our moderator, Madhu Joshi. Welcome.
Thank you, Preeti, for that lovely introduction. And good afternoon and greetings to all participants for joining us today on this very important panel discussion. I'd like to begin with the saying that we say that when the going gets tough, the tough get going. And in our previous session, we heard some tough leaders who demonstrated immense courage and resourcefulness to respond to the COVID situation in their panchayats. These leaders also happen to be women. We have today with us to respond to the women's testimonies and experiences, and very illustrious panel of speakers who have joined us today, both from government and civil society, and we look forward to their rich insights on the issue. To briefly introduce all our speakers, we have with us Ms. Uma Mahadevan, an officer of the Indian Administrative Service, who is Principal Secretary, Rural Development and Panchayati Raj, Government of Karnataka. Next, we have Dr. Preeti Yadav, who is also an IAS officer of the Government of Punjab, who is currently posted as the Additional Deputy Commissioner Development. She is also the CEO of the Zila Parishad of Patiala. We next have Mr. Anand Sinha, who is country advisor for the David and Lucille Packard Foundation, India. Anand has over 28 years of experience in public health, mostly on reproductive, maternal, and child health in India. He has been at the forefront of several innovations in engaging the private sector in the delivery of health services to low-income households. Previously, Anand was at the Gates Foundation and led their Bihar initiative, and prior to that, he was country manager at the Apt Associates. We also have with us Dr. Anshuman Karol, Senior Program Manager at the Center for Participatory Research in Asia, PRI for short. Dr. Anshuman is a versatile and seasoned social and community development professional, having multifunctional experience of 13 years in program management, decentralized planning, participatory research and evaluation, and he has an excellent understanding of the local government system in India. Our last panelist is Ms. Mayuri, who represents the organization PRI. Mayuri is a young development professional with more than 8 years of work experience, covering a range of issues including violence against women, right to food and shelter, health and livelihood. She is currently working as a program coordinator at PRI and is responsible for a very important community-based program called Meri Panchayat, Meri Shakti in the state of Jharkhand, which is driven towards enabling women to recognize their sexual and reproductive health and build their capacity on feminist leadership and movement building. Welcome all speakers to today's discussion. So today's discussion is structured in 3 rounds with a short question answer session before the 3rd round. And I will be posing questions to all speakers turn by turn. And with that, we can quickly move to the 1st round. We all know how COVID-19 threw up unforeseen challenges time and again. We heard how local governments like panchayats improvised, reached out and supported not just government efforts, but also their communities. In this context, I would also like to flag that 50% in most states and 33% in many states, the membership of the panchayats is of women. And yet, people are largely skeptical about the effectiveness of these quotas. We also have research which shows how women leaders at local level are able to better ensure availability of public goods and basic services and how their governance skills improve over time. But we also need to acknowledge that it is very difficult for women when they come elected into the panchayats to overcome the barriers of illiteracy, caste, poverty, and the overarching patriarchy. So our session is not just directed towards how local governments responded and supported the government in its effort to manage COVID, but also what and how do we make the women leaders more empowered? So my first question is to Madam Uma. You have been at the forefront of the COVID management in your state. And we've been reading about the government of Karnataka's efforts, and I was seeing in the newspaper a couple of days ago, you are also looking at upgrading panchayat libraries in the state into learning centers accessible to underprivileged children. So could you please share a few experiences on how the local government has worked and responded to the situation, and especially any good practices by the government? What have been the challenges? And how have you involved women leaders in your efforts?
Thank you. Thank you for having me. And I'm sorry I'm unable to join on video. I'm actually recovering from COVID myself at the moment. I'm at home and I'm on a very iffy internet connection, so I don't want to lose the network. But thank you for doing this. This is a great initiative. I've been following some of the dialogues whenever possible. About Karnataka, I'd like to start by saying that Karnataka has always had 50% reservation for women in the matter of, in all 3 tiers of the Panchayat Raj institutions, both as members and as presidents and vice presidents. That has yielded great dividends, and we are no longer at a stage where anyone is skeptical about the potential of women leaders to deliver. They have delivered magnificently, and they continue to do so. I think one of the greatest testimonies of their ability to deliver has been the response of the panchayats during COVID. In March, what we did was we issued a series of enabling orders from the department, setting up what are called Gram Panchayat task forces. As soon as the pandemic was declared, we had already started taking some precautionary measures. We set up a task force consisting of the chairperson, the members, the staff, as well as frontline community workers like the ASHA worker, the Anganwadi worker, the A&M, the village accountant, the police, even the banking representative, and the village rehabilitation worker. We also set up village task forces because the Gram Panchayat consists of 5 or 6 villages typically. And so we wanted a village task force in each village because going forward, we knew that as and when containment zones were declared, there would need to be local people to help. So what this task force did was really, it had the responsibilities of science-based dissemination of awareness about what is the virus and what are the precautions to be followed, about physical distancing, about mask wearing, and so on. It also had the responsibility of supervising meal supplementation so that there were no disruptions of take-home rations, midday meal rations, distribution of sanitary pads to schoolgirls, and so on. It had the responsibility of overseeing essential services during lockdowns and seal downs and containment. It also had the very, very important responsibility of relief to migrants. In fact, we conducted a migrant survey. The Gram Panchayats conducted a migrant survey, provided sanitary pads to migrant women, conducted organized relief shelters, community kitchens. And finally, it had the most important responsibility of managing COVID in the rural areas, which was of managing institutional quarantine, home isolation, COVID care centers, also setting up help desks and call centers. So most recently, this role of the Panchayat Task Force has evolved to the area of education, because it's been several months since the schools have been closed and children have been cut off from reading and education. And therefore, we thought that we should set up learning centers, informal learning centers, jointly with the education department to support their effort by enabling children to become members of our libraries. I think the ways in which the panchayats have performed has been tremendous. Just to share some numbers, 54,000 volunteers have been trained. All the training, by the way, has been from the month of March. All the training has been done online through YouTube Live, Facebook Live, and so on. And the response of the panchayats has been tremendous to this new form of training. Nearly 10 lakh vulnerable persons have been identified by the panchayats, vulnerable in terms of either health, comorbidities, or age, or even destitute persons needing other kind of help. 33 lakh masks have been prepared by the self-help group, 66,000 pieces of personal equipment. 22,000 self-help groups have taken up awareness activities for 18 lakh people. Over 1 lakh persons were managed in institutional quarantines by in 12,680 institutional quarantines by the panchayats themselves. 1 lakh persons in home quarantine. Call centers have made around 45,000 phone calls. 4.3 lakh migrants were surveyed and 2 lakh migrants were provided relief. We are now taking up an extensive program of dissemination of awareness about child marriage, about the prohibition and prevention of child marriage, and providing the library connect through 5,600 libraries. What this really shows me, and many of us have been discussing this, is that while Karnataka has always been a pioneer in decentralization, democratic decentralization, we had the Panchayat Raj, our own Panchayat Raj legislation, even before the 1993 73rd Amendment came. We had the decentralization efforts of the 1980s, which were quite tremendous. And even the 1980s panchayats had their precursors in village councils and district boards and so on. But I think in 2020, what we have seen is that while we've been talking for close to 30 years, 27 years since the 73rd Amendment, about capacity building and transfer of funds, functionaries, and so on, we've been asking ourselves whether panchayats are ready. Well, they've shown in the last 6 months, 7 months, that they are very much ready, that they have the capacities. And I think what we're seeing is the moment of the next steps in decentralization. And in panchayats taking on a role as first responders, not only during a pandemic or during a disaster, but for all kinds of care and basic services, social services to be provided to the vulnerable and to the needy in their jurisdiction. And I think women have been very much a part of this. They have led community kitchens, they have led relief efforts, they have moved with frontline workers from house to house to prevent any difficulties for frontline workers, for ASHA workers, and so on. They have gone house to house for surveys. Women have been very much a part of this effort, and we are proud of them, we appreciate them, and we are really looking forward to seeing what the next coming months and years will bring in the story of decentralization in Karnataka. Thank you.
Thank you so much, ma'am. That was very informative and very insightful, and there are plenty of learnings for us to take away. I move next to Dr. Preeti. Dr. Preeti, in session 1, we had Jayanti Devi, who is a Zilla Parishad member from Odisha, who shared about the need for panchayat members to have better access to information and better support for them in terms of interdepartment convergence and collective action. Reflecting on her thoughts that she had placed, could you please share with us how the COVID response strategy in Punjab, in the area where you work, how did it involve the PRI leaders, and how did you make sure that women equally participated in the process?
Good afternoon, everyone. As ma'am have very explicitly emphasized the role of PRIs and decentralization in coming times, and of course about the 73rd Amendment Act, I would, although my experience is very limited as compared to ma'am, but limiting it to the Patiala and my experience here, because I was looking after all the COVID related work, and in fact the setting up of all the primary, secondary and tertiary healthcare facilities for COVID. I have looked into that also, so I will emphasize a bit on that also, but let me start with the PRI's part. If we look into the basic structure of villages, whether or not women have a representation in the PRIs or not, it depends on, just excuse me for a while, I will start my video. So if they have the representation, from my experience also, and let me be very clear about it, there are instances where women are very proactive, they are educated enough, they come forward in the decision making process, but there are instances where they are just we may call them as a dummy candidate. But despite that fact, when we talk about empowerment per se and like a progressive society, if they are given a chance to come to the meetings of the Jilla Parishad or let's say Panchayati institutions, or some person is approaching them per se for any certificate or anything, they, at least from that exposure and experience, they gain something which otherwise they are denied of. So let's say if somebody comes for a term and then again they eventually repeat it, you will look at the difference in the confidence level with their exposure, what decisions they start taking in their families. I have seen ladies which have come up from the Panchayati Raj, let's say from the downmost villages, they climb up the hierarchy through the process, politically representation. They have now started coming in the Jilla Parishad as Jilla Parishad members. In fact, our chairperson is a female per se, but the exposure that they are getting is different. Depending on their exposure and educational background and family background, their decision making is impacted. But because coming from the rural area, if you talk to them personally or otherwise, they have a different perspective about the things. Sometimes we are unable to understand, but these are the minor issues. I believe in the SHGs and other platforms, these must be discussed. But in PRIs, in Patiala per se and Punjab per se, because lockdown was a sudden activity, so immediately we started decentralizing in terms of money also. We as government gave power to the sarpanches and Panchayati Raj institution till 5,000 per day to purchase for ration, because it was a sudden thing. But it was synchronized in a manner that not even a single person, because Punjab otherwise is also as is famous for its community kitchens. So not even a single complaint. We have set up all the call centers across the district in urban areas as well as rural areas. In the BDPO office, in my office, it was 24/7 hour activities, and immediately whether it was in terms of food, healthcare facility, or any other issue emergency, immediate response was there. And this response was only because of a communication channel down the line. Like sarpanches were in direct contact of BDPOs, BDPOs were in direct contact with the ADC office, and henceforth. So it was very smoothly taken over, despite the fact it was a very sudden onset. There is a Lok Sanjidari model in place in Punjab, in which community participation is promoted. Like for sampling, etc., we were hearing immediately whenever something new comes, like for this pandemic also, there were rumors going around that if you get tested, or you will be sent to hospital facility which are not good, or you will be isolated from the people. There was a taboo associated with it. But with this Lok Sanjidari model, we ensured with our volunteers and down the line, specifically self-help groups, because I'm COZP, and under NRLM there are 2800 odd women self-help groups which came forward. They went to door, maintaining social distancing, which was quite unexpected and unheard of, that they are maintaining social distancing, giving masks. The women, rural women, it was again acknowledged at national level also. In Patiala self-help groups, they have donated, they have made and donated 2000 cloth double layered, triple layered mask at the time when nobody was even aware that cloth masks will be used and are allowed, because there were certain WHO guidelines for that. So one, I had like sampling, I have told Lok Sanjidari, I have touched a bit upon food distribution, sanitary pads, because in Patiala, in rural area, our self-help groups, they manufacture sanitary pads. So we have tried CSR, we have collected money and we have distributed sanitary pads to rural women at this time, because access was a problem during this time. Then it was another remarkable thing that our sarpanches, in fact, in other areas, it was vice versa, that we have to enforce the lockdown. Here it was like harvesting season was near. So for combines, rural migratory workers come from other states. So some of the panchayats, they were so strict that they didn't allow the entry. Then we had to intervene, that we had made quarantine center per village. I have 1038 panchayats. So there were 1038 panchayat ghars which were turned into quarantine centers overnight with all the basic facilities, and we had arranged for community kitchen and food supply to these centers. If at all any worker, if the village person is going out for livelihood eventually, or somebody is coming, they were given the facility there to stay. They were provided food and taken care of in every matter. There was another something interesting, that we in initial stages only, when the outbreak was uh, happening, we at the government level, a decision was made for the hypo distribution in villages, just in case the sanitation is required. So that was also something very good, that people were made aware. See what could prevent this. If at all it happens, it's not a taboo. How can it be controlled? Then again, for education part, IB, COZP, we started a digital Margdarshan program through self-help groups. That was again women-led. We made WhatsApp groups for the penetration. We made small videos of activities, curriculum-based activities. These were not random activities. We had decided that let's say for maths, if we are going.
Hello, Dr. Preeti, we cannot hear you. Okay, so since we've lost the connection with Dr. Preeti, we can come back to her for the next round of questions. So my next panelist is Dr. Anshuman Karol. Anshuman, we heard from Hashma Khatun from East Champaran in the last session about how she took on her own initiative. She continuously helped women reach hospitals for delivery and took them in for checkups. Based on your experience of working with Panchayati Raj leaders as a civil society organization in Haryana and Rajasthan, could you share with us some of the areas of convergence that worked, and what are the areas where more support and collaboration was needed?
Thank you, Madhu. Can you hear me?
Anshuman, you need to be a little louder.
Okay, okay. Thank you. Can you hear me now?
No, we can't.
Hello?
It's very faint, your voice, Anshuman.
Hello? Is it okay now? What happened? Like, just a minute.
Hello?
Can you hear me now?
Very faint.
I don't. This is otherwise working. Just a minute.
Anshuman, in the interest of time, I will come back to you. If I can just move to Mayuri, if that's all right, and you can adjust your mic. So my next panelist I posed the question to is Mayuri. Mayuri, Kriya works in Jharkhand on this very interesting program of building feminist leadership. So based on your work at Jharkhand, could you throw some light on some of the barriers faced by the women ward members, sarpanches and mukhias, especially in the context of tribal remote populations, and how did it change or not change during COVID?
Yeah, thank you so much, Madhu. Thank you for having Kriya in this very important dialogue series. And to answer to your question, Madhu, I'll say how reservation has been a very commendable. Sorry, let me start my video. Yeah. So, it has given space, it has created space for women to contest election and enter elected offices. But even while elected, often they serve as proxy for, male, female members who are unable to, contest due to reservation. Besides that, gender-based discrimination, caste and religion remain a significant barriers for EWRs from marginalized community. A social milieu that is increasingly polarized on the basis of caste and religions and decades of conflicts. All these, impacts how PRI function, and EWRs elected into office face multiple challenges and barriers. And they remain mostly unsupported by their families, by their community, and to some extent with state level institutions that are meant to build their capacity to function effectively. Gender-based discrimination and violence is pervasive, both in the lives of EWRs as well as for the women and girls in the community. And these definitely impacts mobility, ability to play a visible role in the community as a leader, and results and we have, like, our experience says that it often results in backlash, including ridicule and character assassination that has damaging consequences for them as individuals and affects how they are able to function as leader. And and then so panchayat, which should be a coexisting space for both elected male representatives and EWRs, there is this power dynamics that keeps on playing, and then this also becomes a place where there is this unwanted competition between elected male representatives and elected women representatives. As is like if just to for example, if I'm a male representative and I have all the information, I can access services easily, why would I like to lose that power, right? So these are some dynamics that keeps on playing, and this we have seen not just pre-COVID, but this was very much evident during COVID also. And then these women get to hear that they are not good leaders. So these affects, their, so, and it also affects how they perceive themselves. So they start thinking that they may not be good leaders, and they don't identify themselves good leaders. They are somehow dependent on male counterparts. So these are few barriers. And when I say barriers, and when I say elected women representative, the women there, and when the women there itself, it gives you a picture, a very vulnerable picture. And when I say that that women is a disabled woman, or that women is a sex worker, or that women is a from a tribal community, that doubles the challenges and the barriers. So
Thank you.
yeah, maybe.
Thank you, Mayuri. Thank you for highlighting the intersectionalities. And now I would like to go back to Anshuman, if your audio is back. Anshuman, would you like to respond?
Now you can hear me?
Excellent. Thank you.
Okay,
Please
thank
go ahead.
you. Sorry to bother.
Fine.
Okay, thank you, all the Women in Global Health Catalyzing Center for Catalyzing Change at Rajiv University, and for giving us this opportunity to speak about on this important issue. As Umaji and Preeti has raised this issue that that the panchayats actually, or the panchayat members, especially the women elected representatives, are actually at the forefront in many places. We also had a similar experience in Rajasthan, but there are like few challenges as well. There are few challenges as well, because the problem in Rajasthan is basically Rajasthan has gone into Panchayati Raj elections in January and February, and there are actually newly elected representatives in most of the panchayats in Rajasthan, barring few districts where panchayat elections were on hold due to delimitation. But still, what we have experienced through our the districts and blocks where we are working is the capacities we have built of the Panchayati Raj elected representatives, especially at the Gram Panchayat level. We are working in 104 Gram Panchayats in Banswara district and Govindgarh district of Rajasthan. So they take a very positive stand. Even as you are aware that like in Panchayati Raj institution there is a system of rotation, reservation based system, and almost like 80% of the Panchayati Raj elected representatives will be new in after every 5 years. So the former elected representatives, they also came forward, joined hands with the newly elected representatives, and guided them through like various opportunities available with the Gram Panchayats to provide immediate response towards the kind of challenges posed by this lockdown and the COVID situation. So the first thing they did is basically most of the these former as well as the newly elected PRI members, they have constituted the WhatsApp groups. And since PRI is also working with closely with other civil society organizations, not only in Rajasthan but almost in all states across the country. So we have also constituted a WhatsApp group immediately after the lockdown, and we have started posting the important information in terms of advisories government is issuing, or any kind of response towards the COVID, so that it will reach in a way with a very high speed to all the affected and all the concerned people. So that will prove very helpful for these elected representatives, because as you are aware that like most of the state governments have put this burden on the Panchayati Raj institutions, especially at the Gram Panchayat level, that they need to maintain the quarantine facilities, they need to take care of food and other basic services of the migrant laborers, those who are coming back. But there is also provision under 14th Finance Commission unspent grants. So Ministry of Panchayati Raj has issued an advisory in March itself that 14th Finance Commission grants can be utilized for the provisioning of some services and the maintenance of quarantine centers and other things. So that will prove very helpful for these elected representatives, and especially the former elected representatives help the newly elected representatives to actually get on the things on immediately. The second thing they did is basically, as you know, that the government has announced that Manrega is as an important scheme, and Manrega can provide the cushion to the migrant laborers, those coming back to the villages. Uh, so that will help prove to be very helpful, because in most of the areas where these migrant workers are coming back, so they don't have like job cards, or their job cards were got expired. So the elected representative, the panchayat members actually help them to register register their job cards and renewed their job cards and help them to get jobs under Manrega. So that is one thing. The other thing is they prove to be very in a forefront in terms of like creating a positive narrative around this whole experience, because what is happening when this lockdown was imposed and the kind of migration has started, so the kind of there was a fear in villages that now the people, those who are coming from urban centers, they are coming with the corona, and they will also make us vulnerable to this disease.
Right.
So they tried to create some positive narrative, and that social stigma, they worked on that, and that will prove to be very helpful. We have also issued prepared a policy note on the quarantine centers, because in most of the states, like, the quarantine centers are actually working in a manner which are like people don't want to stay in those COVID care centers, quarantine centers, and they want to get away in the night or something like that. So we have our network partner in Odisha, CYST. They have helped us, and other partners. We have created a guideline on quarantine centers, and we have taken these guidelines to all the civil society organizations as well, all the states, to have a quarantine center to be a home away from home kind of experience they have. And we that guidelines also have a detailed daily routine which includes activities like the recreational activities and the kind of food they can be provided in the quarantine centers and all.
Right.
So that will help us.
Anshuman.
Yes.
Very sorry to interrupt, because we are running a little late.
Sure.
So my next question for my next panelist is Mr. Anand. Anand, the Packard Foundation has been supporting processes to strengthen the public health system, including using a community-based approach and seeing women leaders as part of the solution. That has been a very key strategy for the foundation for about a decade now in India. So could you share with us what prompted you? What was the rationale behind initiating this investing in women leaders, and what have been the achievements of this approach?
Thanks, Madhu, and thank you for convening this group and this conversation. So what was the rationale for us? I think the rationale was quite simple. Much of what happens in the field of public health, where the Packard Foundation is primarily focused focused in Bihar for the last 20 years, has traditionally approached it from a supply side issue. It's traditionally sort of looked at what needs to be done to train doctors, to provide supplies, to improve clinics, to look at sort of those supply side kinds of initiatives. What tends to happen on the demand side is more about how do I create awareness amongst clients? How do I help people understand that these activities or these products are good for their health, these behaviors are good for their health? And that's sort of what's seen as the demand side of what happens in public health. And I think as we began to look at where is sort of the glue in the middle of all of this, I think it became more and more clear that really trying to sort of connect the accountability pieces and the feedback loops between communities and between service providers is an area that that there's clearly has been inbuilt into our governance mechanism. The PRI mechanism is meant to do that. But how actively has that been supported? How actively has that been nurtured? And and really how well does it work in terms of what was designed and what actually happens? Was really the question that I think we set out to try and say, can we try and support this, almost 10 years ago. And you know, and you've been very much part of this journey, and C3 has been part of this journey in terms of trying to understand, you know, how that that sort of that intermediary glue works. And I think the ideal in our mind is that how do you create that, you know, that feedback loop that allows communities and households to, you know, to be heard in a manner that is not confrontational, that is not about complaining, but is about saying, you know, these are the things I need, these are the things I can do, and that those, you know, that feedback goes into people and the infrastructures who are responsible for providing these services, and it can actually become a virtuous loop rather than a loop of confrontation. I think that's really the view that we want. To answer the question of, you know, what have been the results, I want to talk about just two very small stories or sort of insights, you know, observations I've had as we've, you know, observed this. One is, you know, as we observed women, elected women representatives coming into office and sort of trying to figure out what their role is, becoming suddenly realizing, you know, or not realizing what they're allowed to do, what they're authorized to do, what powers they have. One of the small things that is started happening as part of our, you know, of our programs was some women started making their own letterheads. And this is a very small thing, you know, it's like getting a little pad with your name, but writing on it that, you know, I am, you know, elected ward representative for XYZ ward on that. Because one of the big challenges, you know, we learned across the time was that elected women representatives often will go to try and talk to people, even if they're going to go and talk to the ASHA worker or the A&M, they'll be asked the question of, who are you? Why are you here? What gives you the right to ask me anything, right? I mean, on what basis are you having this conversation? And simple tools like that, I mean, of course, there's the whole back end of sort of saying, how do you build their capacities? How do you help them understand what they're allowed to ask questions about? What is it, what does, you know, accountability and feedback and governance sort of mean? But simple measures like that, you know, have really helped. You know, I think the other one that I remember is when we were visiting some PHCs, and some of the elected women representatives told us very proudly about the fact that, you know, one of the steps that they had helped to make sure was that there were chairs available at the waiting area of the PHC. Initially, we thought, you know, what's the big deal about chairs? Surely there's more important things about, you know, equipment, medical equipment, you know, and making sure that there are doctors and nurses. Those are the more important things. Why are chairs such an important thing? But the chairs are an important thing because when women come to these PHCs and they're told to wait, there is nowhere for them to sit. They're told to squat, stand under the tree, wait outside. The fact that you even make this small gesture of saying that, you know, okay, fine, come sit and, you know, put a fan and you can wait for the doctor is first sort of step of saying that, you know, we are trying to be caring and we are trying to be client centric. These types of things happen or will happen more if it is elected women representatives or if it is women who are making the observations and women who are defining what it is that the community needs. We feel very strongly that, you know, women are much better placed to sort of make these observations, to figure out what are these developmental needs that really affect their community, versus sort of more, you know, where the male-centric approach tends to be much more about, you know, infrastructure needs and building roads and putting up lights and you know, and things like that. I mean, how are the observations really empowering the community is another one of the, I think, you know, important lessons that we are learning, apart from, you know, many other things that we've learned over the last 10 years.
Thank you, Anand. Thank you for visualizing your response with these excellent examples. And I mean, we've heard some very good practices from Punjab, where they were trying to address, say, the menstrual hygiene needs of women migrants. We heard about how the self-help groups on their own activated and, you know, created the masks. And we also heard from Dr. Anshuman about the efforts that were made of collaboration between old and new panchayat members, which is very vital because every time, because of the rotation of seats, there is a new cohort coming in and they need that capacity building all over again. And this partnership is a very good strategy. We also heard how large numbers of panchayat members and officials were trained online through the government of Karnataka, and there's a question on that which I will be sharing later. But with this, we move to round two, where we speak more to our panelists about the way forward and solutions. We all see how panchayats are supposed to be the go-to platform, so to say, to implement many of our development missions. And that's mainly because of the high credibility that they have in their communities, the close connect and understanding that they have of the local issues. But we also, it is in a way, it is unfair for them to just to expect that they will just get up and deliver without sufficiently equipping them with information, with coordination, with resources to play that role. And time and again, when the panchayats do not deliver, and when they happen to be women, then the disadvantage is amplified even further. So we're going to ask our panelists in this round about what could be the potential policy responses to address these concerns. So we come back again to Ms. Uma. Going forward, you said that Karnataka is now ready for the next phase, and there has been considerable good experience that we've seen in COVID, where there's been excellent coordination and spontaneous response. But what do you think are the the top 3 areas where you need to build the capacities of women panchayat leaders, and what could be the policy direction on that one?
Thank you. That's a good question. And I've been listening to all the other panelists, very, very interesting insights. So Karnataka right now, as you know, most of the panchayats elected bodies have completed their terms. We have administrators, and in due course, we'll be going in for elections. So this is a time when we're planning the next round of training. And I think training to perform from day one is one of the key priorities at this point, and should be the key priority for any state that's planning to prepare its panchayat leaders for effective performance. So COVID has already shown us that training, online training, along with face-to-face training, I think we have an excellent network of training training infrastructure in the state. We have district level as well as taluk level training centers, both for residential training and for day-long training. But one thing that we have found is that online training for content and for procedures and for information is very, very useful. And we have equipped our panchayats with proper infrastructure to absorb the training, television screens and computers and projectors and so on, and good internet connectivity. So training to reach at scale, and what should be in that training, not only the content of the act, but also information about processes and procedures within the panchayat. For example, we have a very important convergence meeting, because much of the work of a panchayat really happens not through individual sectors or individual departments, but through convergence. And so we have an important convergence platform called the Karnataka Development Program, KDP meeting, which happens at the state level, district level, and taluk level. But since last year, for the first time, it's also happening at the Gram Panchayat level, where all the frontline and field level staff of the 29 sectors which come under the jurisdiction of the Gram Panchayat meet, and the chairperson reviews the progress as well as the issues, local issues. For example, if, just to give you an example, if an Anganwadi is having difficulty in getting cleaning materials, panchayats have been known to provide from their funds cleaning materials, phenyl and various other cleaning materials, because different Anganwadis of different sizes are not able to manage within their resources. This convergence meeting tends to solve a lot of issues, and this is something for which we need to prepare the leaders, because it's only if they can review properly that they can get to the issues. The second thing is that we have a bunch of grassroots committees. All states have these: Anganwadi committees, school development committee, the village health and sanitation committee. What Karnataka has done is it has brought all these committees as subcommittees of the Gram Panchayat. Now, in the bureaucracy, we often, joke about how committees really don't get work done. But at the grassroots level, it's committees. Committees are groups of people, they're teams, and they're teams with diverse voices. And they are the ones that actually bring in all the stakeholders' perspectives, they bring the issues, and they actually work to get things done. So these grassroots committees have now become subcommittees of the Gram Panchayats. Their proceedings, their monthly meetings or tri-monthly meetings will be brought to the Panchayat, tabled in the Panchayat. The Panchayat will take a look at it every 6 months when the Gram Sabha is presented with a report. Main issues at the grassroots committees will be presented at the Gram Sabha. So this is an important process of accountability as well as of making things happen. The third thing that I think is very, very important, especially given that we're focusing on women leaders, is that the link between the convergence and the link between panchayats and women's collectives, be it NRLM collectives or other different kinds of self-help groups. Karnataka also has, along with Sanjeevani, which is the NRLM collectives, we also have the Stree Shakti, which is our homegrown self-help group program. We also have different NGOs who have their own self-help groups. The important thing is that the link and the strengthening of the relationship between the panchayats and the collectives. For example, what we're doing is all participatory surveys, like the out-of-school children survey, which is done every year. For this time is going to be done by self-help group members, women members. We've also trained women members in partnership with specialist organizations. We've trained them as sanitization and hygiene entrepreneurs in view of COVID. If there's a COVID case in a particular panchayat or in a particular office, local office, after the office is sealed down, the sanitization is done by women entrepreneurs. Women are also participating actively in MG and Rega nutrition gardens, and this is an important point of convergence. The next point is that disaster management committees at the Gram Panchayat level need to be strengthened. We've set up disaster management committees. This week I inaugurated a training program, again an online training program for disaster management committees, because I think it's the Gram Panchayats which are the first responders, and they are the ones who can really help the vulnerable. And that's an area where, again, using the natural emotional connect of women, I think that's a very, very important, because women tend to be often the vulnerable. And therefore, women members and women leaders can reach out to women who are in distress, especially women who are single women, destitute women, sex workers, women street vendors, these kind of categories. Women leaders can do a lot. The final 2 points I wanted to make are that we need to support with a digital platform. Karnataka has an excellent digital platform called Panchatantra, but we are now, I'm happy to say that we're now designing Panchatantra version 2.0, which will also have a mobile application. We find the smartphone use among panchayat leaders is growing, and a mobile application with speech to text and text to speech and so on will help them to understand the working of their panchayat much better. Exposure visits are important, both within the districts and the state. And the final point is that in all this, we must not forget that training must contain a very strong component of gender conscientization, a feminist approach to progressive social legislations, especially about issues like child marriage, the Juvenile Justice Act, the Rights of Persons with Disabilities Act. These are things that sometimes we forget or do not dwell on importantly in our trainings, but we need to bring them back right to the center of the training and conscientize our women leaders for the work that they need to do, because that really can take these legislations further within the communities. Thank you.
Thank you so much. Excellent, excellent sharing and points and takeaways for all of us who have been listening. I think that you made this very, very important point of the coming together of the two local, stakeholders, the self-help groups of women and the panchayats, 50% of whom happen to be women. Also, that there is a political commitment towards promoting convergence. I think these convergence committees right down to the panchayat and village level will really work, and we will think of adapting some of these learnings to the other states as well. And even the online training is the flavor of the season. Everyone is talking about it, and we will come back to you with, there are some questions from the participants on the online trainings. But I will ask my next question to Dr. Preeti. Dr. Preeti, what could be some of your solutions from your experience? How can we make the decision-making process more inclusive? How can we make the voices of women leaders who are working on the ground involved in the decision-making process? You have mentioned how, initially women who come are not so confident, but with experience and exposure, they become more and more confident. At the same time, what would you think that the system can do more to promote them, to build their confidence, to build their leadership skills?
Yeah, this is in fact a very close topic to my heart, because daily basis I meet women sarpanches, punch, for that matter Jila Parishad members, to the extent that I actually have to shut doors to keep their husbands out, that they are the only members and they are going to join me. They have a certain level of fear. They lack that exposure. It's not that they don't have ideas. We always say that in a family, it's the women who makes key decisions of savings, or let's say if uneducated also, major decisions if we go in rural areas also are done by them. They have certain voice, they have experience, they have seen everything, but they have that hesitation and they are afraid to put, like in my office, if somebody is coming for the first time, looking at the like one sevadar is standing out, so they get certain hesitation that whether they will be able to conduct themselves, speak well, or they might not commit some blunder or say something foolish. So that is the thing. So we have to give them an atmosphere, we have to make them comfortable, because there is a thing, I don't know, I'm sorry to say, but there is a certain thing we don't allow women per se and otherwise also certain people not to express their mind, speak their mind. There is a certain societal pressure, sort of like you have to be like this, let's say I'm not starting my video because I will disconnect due to certain reasons. Earlier also I was cut off. So let's say if they are doing certain things, you have to behave in a particular manner, like you have to sit there or be respectful. There are a number of issues. But if I am meeting a sarpanch, and if let's say there is an inquiry or another discussion, like for convergence also we have discussed, and I'm making her comfortable, I'm allowing her to speak, I'm intervening in between, but in a conducive manner. Like if she's putting across some point and I say, yes, this is the fact, this is the truth, we have also faced the same thing. Let's say, for example, if she says that she's not allowed to do this, and I also say that I was not, let's say it's hypothetical, but just to give her confidence, then they start opening up. They tell me that this is the issue there, like in that panchayat where there's an issue of washroom, this needs to be done. If in school we do this thing, that this will help girl children. So these are actual issues, but to make them express themselves, we have to initially give them that atmosphere and confidence. Giving me a reservation and then making them act like a dummy candidates is not something that I approve of. And I believe if we handhold them in decision making and take their views, then definitely it's going to help. Like previously convergence was told, I have a quick point to add to that also. When we talk about convergence, there are n number of departments, n number of funding mechanisms, n number of schemes. But if those are converged together, we can come up with a beautiful asset. For example, let's say for Anganwadi, in Narega, if we take, there is an upper limit of 5 lakhs. But if we make a proper room with everything, like let's say smart Anganwadi center, that have all the facilities, we smart Anganwadi is, so we will need additional 2 lakhs fund. So those 2 lakhs fund can be merged from WCD, panchayat funds. There are other things that can be put into the picture, and that planning has to be done at the ground level. But due to the lack of knowledge, it's not done. So it will take immense patience, trust building mechanism, knowledge building mechanism. Online training is useful, worth a while. In Punjab also we have mechanisms and all the system in place. We have everything in schools also. We are going with the smart school. In fact, smart village campaign is also there. So we are trying to make our villages also smart. But online training lacks a certain thing that I call human touch. We have to actually sit with them, tell them, build that confidence, explain to them. All decisions in PRIs are done on the political, whatever they deem thinking. Let's say they want to make a road. but I know that there is certain project in which underground pipe is going to come. So I will, if I tell them, let's delay the road for another year and let's do this for now. And if I explain to them the reason, they are on board immediately. I have not seen even a single panchayat in which if I go and I tell them, let's do this, this will make our village more fruitful. It will be more fruitful to the society and community in general, and they are on board. So I believe women per se plays a very important role, but we have to instill that confidence and we have to handhold them. Similarly, other male members also, I believe we have to handhold them also in the decision making and give them the actual benefits, what we are going to reap in future. So everybody comes on board the moment we explain that, but that takes a lot of effort.
Thank you so much, ma'am, for highlighting the importance of addressing the basics. When she first steps out of her home to attend a panchayat meeting, it's a long journey from where she can actually address the meeting. So thank you for highlighting that. And also thank you for highlighting the limitations of a digital approach. There are states like Bihar, Jharkhand, Odisha, where the digital connect is very limited. And also we know that even if there's a smartphone in the house, it's with the male member of the family. So all of that adds up to completely, diminishing a woman's confidence. And so with that, I would like to now move on to Mayuri. Mayuri, if you could share on a little bit about the strategies that have been adopted by CRIA to address these very barriers that women leaders face, and could you share them in the form of some recommendations that the government representatives present in this panel could also take up? Over to you, Mayuri.
Yeah, thank you, Madhu, again. So, Madhu, Kriya initiated Meri Panchayat, Meri Shakti program, not just in Jharkhand, but in Uttar Pradesh and Bihar also. So, with a belief that strengthening the feminist leadership of EWRs can have a ripple, effect in making the PRIs a more gendered space, and will ensure, issues related to women and girls are raised and addressed. And recognizing that most elected women representatives lacks knowledge and skills to be effective lead functionaries, CRIA prioritized capacity building as the core strategy for the program. And my recommendation is thus on the on the core strategy, that is the capacity building. So and our experience with the advocacy with the government also gives us this opportunity to share that a curriculum based training for a separate training for EWRs. So I'm not saying that EMRs, all elected representatives should not come on a common space and share an interface and experiences. But what I'm emphasizing is that women leaders need a separate set of training, a curriculum, and not just on functions and roles and responsibility, finances and accounts, but registers, but also how the gender role affects and how those could be countered, and they can play a better, they can be leaders better. So including gender, sexuality, and leadership issues and in the curriculum, and then building the capacity. And through just another thing that I would like to mention, throughout this COVID thing, an IVRS based system service was initiated by CRIA under the name Badte Kadam Panchayat Ki Or, and it was recognized by government because we shared the success stories from that campaign with the government, and they have recognized how this has helped in during COVID also. This has helped in building capacities of not just EWR but SAGs and women and girls in the community. So it's definitely on capacity building.
Thank you, Mayuri. I'm now moving next to Anshuman. Very quickly, Anshuman, now there's considerable conversation around the gendered impact of COVID. And you have considerable experience of integrating gender concerns in panchayat planning processes. So what systems and processes would you recommend that need to be in place for a more gender integrated planning, especially in the COVID context?
I would say that we should think it beyond COVID. Like COVID is a is a phase. This is unexpected, and we are facing this thing. But it is not that gender concerns are not there for the past like 27 or 28 years of Panchayati Raj institutions taking place. As Priya, what Priya has experienced since like 1993 and when the first Panchayati Raj elections were taken place, like few panelists have raised the issue of dummy candidates and the woman leadership and women this thing. So that is very important. I think the capacity of the woman leadership needs to be nurtured. There should be a continuous effort to nurture leadership in women candidates, and more importantly, as we know that whenever the decisions at the gram panchayat were taken place, so whether it's a woman sarpanch or woman president, but majority of the decisions were actually taken by the male counterparts of or the panchayat secretaries, or the decisions were actually enforced by the upper tiers of gram panchayats or from the government officials. So what we did is we have experimented a concept of Mahila Sabha. It was actually started with the UN Women program in 2009, but later only Maharashtra and Himachal Pradesh are the only two states which actually made amendments in their Panchayati Raj Acts and make women this Mahila Sabha mandatory before the Gram Sabha meetings. So we have piloted this initiative in Rajasthan also, and we have experienced that it is very difficult for women actually from the community or as well as from the elected representative, women elected representatives to came forward with the woman related issue or child related issue, because most of the discussion in Panchayati Raj institutions are around like infrastructure building and this thing. And most of the states, and it is made mandatory by the government also after 2015 that all the plans should be all the expenditure, gender based budgeting should be done. But again, that is if you analyze the budgets and if you interpret the budgets, actually it is even if you're making an infrastructure within if you're creating a maternity ward, that can also be seen as a gender-based budgeting can be, but that is not necessary that all these kind of efforts are actually targeting the softer issues actually which women are facing. So this concept of Mahila Sabha we have piloted in Rajasthan, and as a result, state government has issued notification last year that before all the 4 mandatory Gram Sabha meetings, there should be a Mahila Sabha meeting. And we have not only worked with the community, but worked with the women elected representatives, but also worked with the community or the women in the community that they should come forward and take this space of Mahila Sabha to raise their demands. And as a result, also the government has notified that 40% of the budget which is coming under the 14th Commands Commission for the preparation of GPDP, that should be the expenditure should be made on the women and child development activities. So these are the two actually promising things were happened, and we are also in touch with other civil society organizations across the different states that they should also pitch for this Mahila Sabha, mandatory Mahila Sabha in the act, because even you know that even if the Gram Sabha meetings are happening actually, and in almost all the states there is a provision that if there is no quorum in the first Gram Sabha meeting, that quorum is not required for the second Gram Sabha meeting. And this lacuna is actually there. Many sarpanchis are actually taking advantage of this thing.
Right.
Regarding the convergence thing, I think it is very important to talk about at the state level under GPDP, this is the opportunity. But if you see the GPDP plans, it's mostly made around 14th Finance Commission, or now it's 15th Finance Commission, and the Manrega and the Panchayat owned resources, and Pradhan Mantri Awas Yojana, but there is hardly any convergence from the departments. So this is the challenge actually we are actually facing for the past 14-15 years since the BRGF were imposed, but still that is a concern. And DPCs also is a very strong base at the district level, which can ensure convergence. So
Right.
district committee should also be actually revitalized and
Right.
to take care of this thing.
Thank
Thank
you.
you.
Thank
Thank
you.
you.
Thank you, Dr. Anshuman, for highlighting this point about the Mahila Sabhas. There has to be a proactive policy push towards making the community women also participate. And I think that's a very good suggestion. And we will come back to you. Maybe the participants can also write to you to understand how you actually made that happen. And finally, I move to, before we go into our responding to some of the questions from the audience, last word to Anand about what more needs to be done really. What are the lessons learned from your experience of working with elected women representatives? What do you think as the foundation, or what does the foundation feel that what more right now you are supporting them, mentoring them to become effective leaders? But what more needs to be done from the side of the system, perhaps, and also maybe in the ecosystem that needs to, for them to fully play that role?
So I think there's, okay, so let me keep this very brief. One of the observations we have is that when it comes to elected women representatives, they tend to be on extremes. They are either on the extreme of being the proxy agent who is voiceless, who is not, is not really a representative, who is a stand-in candidate. I mean, the fact that we have, we so commonly refer to this term MP, at least in rural Bihar, as being the Mukhia Pati. So there's an official term for it almost, which recognizes that the Mukhia is a woman and it is her Pati who is actually the person who, who holds the reins. And then on the other hand, there is the other sort of, I think, end of the extreme, which is that when women sort of get a flavor and get a taste of, what it means to be an elected representative, to have the rights and abilities to sort of, exercise their powers, to be a voice, they tend to do amazing things. They tend to do things which are truly transformational. They tend to have insights which are beyond what we would normally be able to observe. So I think it's, we tend to view the role of women as falling on these extremes. There isn't a huge amount, well, let me not say there isn't a huge amount. There is a lot of effort needed in actually moving women from one side of that scale to the other side. Some of it is simple things like training, awareness, creating, the basic skills and abilities. And there's also a lot of the issues around patriarchy and what are the social structures within, which they operate within. But it's clear that that's where the investment needs to go. And it's not going to be a short investment. It's not about an election and then a training one-off that will solve for this problem. And it is a cohort approach. The elected woman representative is in power for 4 or 5 years, is the duration that she has. There is an opportunity throughout that process to actually enable her to fulfill her role. And I think we need to see this from a long-term investment perspective throughout that entire sort of continuum, so that she actually has the chances of coming back again. And sort of, I think that's when we see this virtuous cycle coming in place, is when there's, first time elected women representatives, understand their role, receive the training, receive the skills, have the confidence, and then say, okay, come back and I'm going to do this. And I do have the ability and the confidence to stand on this. So I think that's really where we need to invest. One of the key things is, it's clear to us as a donor partner, and as a philanthropy, that we have, we've invested in this for 10 years. And it's not one of those kinds of projects where you can say at the end of 10 years, okay, I can let go. Because it's not going to actually walk on its own feet unless the government, unless, other partners come in sort of to work in this area. And to a certain extent, as a donor, we feel that other donors approach this area with a little bit of trepidation and a little bit of reluctance, because it's seen as an area where there is potential engagement in issues like governance and accountability, which might be confrontational with civil society and government, or which might sort of, tread on some of those sorts of sensitive spots. But I think again, the experience has largely been that, when these systems work, they work in a very supportive manner. They do not work in a confrontational manner, unless you really want them to become confrontational. I think in the natural state of things, they are supportive to each other. So I don't have any specific ideas, but as I'm saying, I think the journeys are very clear. The need to invest over a long term is very clear, and the results will speak for themselves, because it's very clear in my mind, when you have women in these elected representative positions, they will either be at two ends of the spectrum. They will not cluster in the middle, which is what we see with men, unfortunately, is that they tend to cluster somewhere in the middle in terms of what their role might be. And the question in terms of investing in women elected representatives is to bring them from one end of the spectrum very quickly to the other.
Thank you. Thank you so much, Anand, for highlighting the importance of the journey, so to say, the evolution. So we have just about 10 minutes before we close this meeting, and I will quickly pose some of the audience questions to some of our panelists. So the first question is for Ms. Uma Mahadevan. The question has actually come from Bangladesh, a participant from Bangladesh, and he says that the data shared by you was quite impressive, and so was the entire setup of forming a COVID task force. He has a question on the challenges that was faced by the government, because when you work as the government, the scale is huge. So what were there any challenges? I'm sure there were, about training and communication to the various members of the task force and the volunteers, and how did you really overcome the challenge, and what was the mechanism that you put in place to track the progress of these groups?
Thank you. So yes, of course, anything at this scale, Karnataka is a state with 6.5 crore population. Anything at this scale, we have 6,012 panchayats, and at any given time, the panchayats have around 95,000 to close to 1 lakh elected representatives, and 80,000 odd staff. So it's a huge scale, and doing anything at scale has tremendous challenges. But the first challenge was really how to communicate with our panchayats. And there that's where we found that going online, we were a little skeptical and a little unsure of how, YouTube Live, whether they'd come online on time, whether they'd have the connectivity, whether they'd be able to mobilize in time for the trainings and so on. But the very first session was so well attended, and had such, so punctually attended, so well attended, and such very, very alert questions. The first session was really just about COVID, about precautions, about what is the virus, what are the precautions, what are the things that people need to do, what is the way to communicate, how the task force needs to meet, how they need to protect themselves, and so on. And the questions that were coming in were so insightful and so alert, and so this thing, that itself gave us the confidence that here is something where we can take this forward. This is the first thing. And so we had trainers at the highest level of government. I participated, the health commissioner participated, the training head of the state participated. And so we stayed to answer every single question. And immediately after that, we responded with a little FAQ document. So everything that we sent, the training PPT would be sent a couple of days in advance so that they could download it, print it out, share it, read it. And immediately after the training, the FAQ would be sent. This was one of the things that we did. So that really helped. The second thing that we did was, in January itself, we had, even before COVID, we had started a Telegram group where we communicate along with WhatsApp. We use WhatsApp a lot, but WhatsApp has a number of limitations on the number of members you can have and so on. But because we had 6,000 panchayats, we had a Telegram group where all the panchayats are now on board on that Telegram group. And that's an excellent forum, because all day long, and sometimes well into the night, early morning, there are conversations. What it's interesting in the Telegram group is that it has become a peer learning platform. It's not so much that we respond. Of course, I and my colleague, the other principal secretary, RDPR, both of us are on it, our commissioners are on it, and the CEOs of the Zilla Panchayats are on it. But the panchayats themselves are asking each other questions and solving issues for them. So that's the second thing. So judicious use of technology, along with a lot of turnaround should be really, really quick. So a lot of responsiveness to their issues, and ongoing conversations with different groups, through video conference, through visits, physical visits, of course, we've been doing relentlessly and repeatedly. Those are things that we've done. Challenges remain in terms of the kind of, in COVID itself, we had challenges of, you know, panchayats, certain panchayats were short of funds. Then we had to draw for running migrant shelters, for running different things. Then we had to draw from the disaster relief fund, things like that. So it requires tremendous support from the government department, but that support is well worth it, because the uptake on the ground is so good that it gives you a good feeling that there is worthwhile, there are worthwhile efforts going on the ground, and that really helped. That is something we plan to continue even beyond COVID. The Telegram conversations, the peer learning platform, the online training to support and to complement the face-to-face training, which again, this thing. I also just wanted to quickly add, Madhuji, that what Anshuman was saying about Mahila Sabhas. Mahila Sabhas are very much a part of Karnataka Panchayat Raj Act, and we conduct both Mahila Sabhas as Mahila Gram Sabhas as well as Makkala Gram Sabhas, which are children's Gram Sabhas, every year, often twice a year, but certainly once a year, compulsorily, they are conducted, and they're conducted well. We get photographs. So on monitoring, the last point, on monitoring, as I said, we have this platform called Panchatantra, which right now is not real time. The Panchatantra 2.0 will become real time. And we propose to have all the meeting proceedings and details of information of all this, all these initiatives uploaded in real time on Panchatantra. Right now, we use a mix of whatever works. We use Google Sheets, we use the Panchatantra platform, we use email. We also use regular monitoring reviews by taluk executive officers of the panchayats within their, each taluk has about 30 to 40 panchayats. So the executive officers review, and then the CEOs review. We review at least once a month, if not more often. So there's a very, very detailed and meticulous process of review as well.
I think that's very impressive that the government of Karnataka is taking monitoring and review very seriously, because most times, you know, once you set up committees and things are in place, it's not a priority in some cases. But yeah, so that's another set of good learning. We're nearing the close of this meeting. So there is one suggestion from a participant to Anand actually about what do you think of a management course for panchayat leaders? I mean, whoever initiates, and you know, because I think the participant also thinks that leading panchayats, working for panchayats, actually a professional work, and many people would benefit, especially women, from this training. Yeah, Anand, your response?
I agree entirely. I mean, I think we've totally underestimated the inputs and the support and the rigor of the support that we need to people who we're asking to become community leaders, who are being elected to be community leaders. The assumption, unfortunately, is that because they pass an election process, they've somehow readied themselves through that process. But we know that, you know, that that's not the case. So the level of inputs and the idea of, you know, supporting you know, elected leaders through a management course is fantastic.
Yeah, so thank you to all the speakers, and since our participants have been consistently with us throughout this meeting, I would like to close by summarizing some of the key takeaways of the panelist remarks. One is definitely digital is the way to go, but we have to make sure that the digital divide is bridged, and especially for women, where in a country maybe in the more prosperous states where more women have access to phone, but again, the usage of the phone, what do you use it for, is important. The very important point of collaboration of panchayats with self-help groups is a good learning takeaway. Definitely, there's no getting around not addressing the root causes, the cultural barriers. And we heard how Preeti ji takes a personal interest to walk with the women through this journey and build their confidence. And that kind of high level commitment is very critical if we want to make the Panchayati Raj system a reality. We heard from Dr. Anshuman about how systematically you institutionalize women's participations through the Mahila Sabhas, and we heard how Karnataka also has the Bal Sabhas. And we heard from the Kriya experience how a certain kind of training is important to build a feminist perspective. So in closing, before I hand over to Preeti for the vote of thanks, I'd like to say that the region of South Asia has been marked for its unique context where women's access to politics seems to be less affected, so to say, in spite of our gender norms. As per the Global Gender Gap Report, which has data from 153 countries, a 2020 report, South Asia actually scores highest in the political empowerment sub-index. So, I mean, there is a high level of motivation, but leaders, not just women, but also men, are constrained by lack of access to information and convergence of departments. And I think governments are getting there. We are getting there. And I mean, my last point would be about affirmative action and the importance of gender quotas. It does ensure that a large number of women enter into politics and participate in governance, but it does not ensure that they participate equally. And that's because they start from an unequal, starting point, so to say. And so that push and that investment, there is no getting around that. But once that happens, there is a lot of self-motivation. We heard from the 3-4 women leaders who participated in the previous session as to what things they could do. And we at C3 conducted an evaluation as to why women do what they do. We trained women to become health advocates, but they built a school, they built bridges, they responded to floods. And when we asked them, why do you do it? So they say, it's something that builds my self-esteem. It makes me feel good about myself. I feel respected in the community. I feel respected in my family. So it gives them a sense of self-worth. And definitely, I think this is common knowledge and common sense. So definitely more needs to be done, more is being done. And with that, thank you, a big thank you to all our panelists for their rich, very, very rich inputs and sharing a lot of information from the government side. We learned a lot, and we also learned from Kriya and Priya about what strategies they have been employing. And of course, from Anand, we learned about why they're investing in women leaders. So thank you, everyone. And with that, I hand over to Preeti.
Good evening. And I think we've had a very interesting discussion. We would also like to place on record the different partners, including Policy Core, where this dialogue series, as it gets summarized, is going to be available online at the WGH website, but it is also going to be available as a report, which will be published soon. So we look forward to several more dialogue series coming up. We would like to thank all the panelists and the moderators. Thank you so much. Bye-bye.
Thank you. Thank you.
Thank you.
Thank you so much. Thank you, WGH India.